All right, welcome. We're recording live at the Canadian Rheumatologists Association Annual Meeting 2017. We're live from Ottawa, and we have a very special guest for this segment of Speaker's Corner. I'd like to welcome Dr. Evelyne Vinet. She's an assistant professor at McGill University, and she's an expert in lupus. And we're going to learn about lupus today, particularly pregnancy and lupus, so a very focused segment on women living with lupus and some of the challenges that they live with getting pregnant and then after delivering babies. So I'd like to start by welcoming Dr. Vinet, and maybe you can just tell us a little background about how you found yourself in this particular area of rheumatology.
Okay, perfect. Thank you very much for having me. So my first patient that I ever had as a medical student was a lupus patient. She had lupus for many years, and really I was fascinated by her story and how lupus had affected her life. And it really made me realize that this autoimmune condition can have multiple ways of presenting itself and can have a profound impact on the patient.
So for some of our audience who might not be familiar with lupus, can you just tell us a little bit about the disease, the prevalence? It affects obviously women, and how many people have it, and what are their lives like living with the disease?
So lupus is a multisystemic autoimmune disease. So this means that the body produces antibodies that targets our own, okay, so not only foreign entities but ourselves. So it can produce inflammation, particularly in the joints as well as in important organs such as the kidneys. And it's particularly women that are affected with lupus. And when we look at lupus patients, there will be 9 women affected with lupus compared to 1 man among all lupus patients. And particularly it affects females when they are in their childbearing years. So between the age of 20 and 40 years, this is really where lupus can develop most frequently, although it can affect any age. And it's in Canada or in North America, approximately 1 over 2,000 female will have lupus, and particularly during childbearing years, it will be 1 over 1,000 female.
And is it a type of arthritis that is very challenging to treat and to get people stable and living their lives successfully with it?
So the arthritis in lupus compared to, for example, rheumatoid arthritis will not typically cause damage in the joints in most of the patients. So in that sense, it's in a way it's not easier to treat, but often with the treatment, patient will have a response. But we have some patients that the arthritis might be challenging, but at least there is no bone destruction in most of the patients, the vast majority of lupus, compared to some patients in rheumatoid arthritis, where this is really what we want to prevent in rheumatoid arthritis. The main difference with rheumatoid arthritis is that with lupus, really we can have important organs involvement really more frequently than in rheumatoid arthritis. So particularly the kidneys can be involved, and this might be also, some women with lupus might not feel any symptoms when they have kidney involvement, so they really need to be followed. And also they can have other manifestations such as cutaneous manifestation on the skin, as well as pulmonary problems. But once under treatment, we can control the disease, but it's a chronic disease with periods of exacerbation and remission.
Okay, so your particular focus in your research is on pregnancy and lupus. I guess to start off, our audience would probably be interested, particularly our women viewers, what sort of risks are there for women with lupus to conceive or to get pregnant and to have a child?
So women with lupus might see during their, it's very important when they are contemplating pregnancy that their disease be in a quiet state, because it has been shown that when the lupus is active, women with lupus will have more pregnancy complications. So that is really well established. Although when the disease is quiet, when it has been under control and for 6 months before pregnancy, then the vast majority of women will have a normal pregnancy with close monitoring. And then during pregnancy, women with SLE, with lupus, might have more symptoms, okay, in some cases, because we think that the pregnancy might influence the disease activity. Okay, so they need to be monitored. And as well, some medication that women with lupus are taking to control their disease cannot be used during pregnancy. So we often need to switch medication before our pregnancy, and we have to make sure that patients are stable before the pregnancy and follow them appropriately during pregnancy. But it's really important to know that women with lupus can conceive, okay, and they can have a very successful pregnancy, but it has to be planned, and really it's very gratifying to follow women during that particular time of their life, because for many of them, it's really a desire to have a family, and it's really something possible.
Well, it's an incredible story of someone who's living with a chronic disease, who wants to really be able to take control of their lives and live their lives as fully as they can. And certainly for a woman, this would be an incredible experience, not to give up that hope, exactly, to give up that opportunity. So there is a risk then that the lupus, the pregnancy could worsen the condition during pregnancy, so they have to be careful. Are they monitoring for the same symptoms or side effects during pregnancy as they would in the normal course of their life, or are they watching for particular things that might be related to the pregnancy?
So during pregnancy, we will monitor for disease activity for the lupus, which will be the same as outside of pregnancy, but during pregnancy we might have more frequent follow-up than routinely when we are not pregnant. And then also the other thing that we will be monitoring also is that partly we want to focus on the blood pressure, because this is one of the aspects of the pregnancy. So women with lupus have an increased risk of having a condition called preeclampsia, with high blood pressure during pregnancy, and can lead to protein in the urine. And this is very important to follow during pregnancy the blood pressure and monitor the protein in the urine, since women with lupus, this is one of the complications that they might experience. And also they need to consult early in pregnancy, because there's preventive treatment. For example, low-dose aspirin can be given to women with lupus because they have a higher risk of that specific condition. So it has been shown that aspirin in women at high risk of preeclampsia, that high blood pressure condition, can lower substantially a lot the risk of that condition and complication in lupus pregnancy.
Are there associated risks for the baby? Can the baby inherit the disease?
So for the inheritance of the disease, in lupus there's a genetic composition, but it's not as strong as other conditions where we really see in some families maybe affected individual. In lupus, for example, if the mother has lupus, there might be a tenfold increase in the risk of the child of having lupus as an adult or later on in his life. But still, we have to know that the tenfold increase is for a risk that is about 1 over 1,000 or 1 over 2,000. So the risk is still very small. So most women with lupus will have children that won't have lupus when they'll be an adult. Okay, but there's one condition during pregnancy. It's very rare. It's when there's a specific type of autoantibodies in the mother that we need to follow. Is that some antibody might across the placenta and cause the arthritis of the baby to be slow. So they have to be followed, but it's very rare. In those that have that antibodies, that specific antibody, it's approximately 1 to 2% of mothers that will develop that problem in their child during pregnancy.
Now, the focus of some of your research and the presentation that you're making at the conference this year is on a particular aspect of lupus and pregnancy, and that's postpartum depression. Could you share with us, I know we don't have time for your entire presentation, but maybe a summary of that presentation and some of the findings that you're sharing with other doctors here at the conference?
We really wanted to study this aspect because it has been shown before that outside of pregnancy, women with lupus have a twofold increase in the risk of having depression. But no one had looked specifically at the postpartum period to see what was the risk of having a postpartum depression. And we know that in the general population, the 12 months following delivery is a crucial period where approximately 8 to 10% of women have a postpartum depression. Knowing that women with lupus might experience pregnancy differently or have pregnancy complications in some cases, they might have an increased risk of postpartum depression. So we use Quebec Administrative Database, and we had a large sample of women with lupus with more than 700 pregnancies. And we observed that women with lupus had a 40% increase in the risk of postpartum depression. However, the risk was mainly in those that had a prior episode of depression or other mood disorder, okay, and as well as those that had pregnancy complication, which both have been already shown to be a risk factor for postpartum depression. So this can help us to target some women with lupus in the postpartum who may be more in need of intervention for potentially postpartum depression.
We know that people living with chronic disease, people living with inflammatory arthritis is an example, how critical to have that support network around them. So a woman who is successfully has a baby living with a lupus condition, obviously that support, the partner, the close friends and family, particularly post-delivery, those first few months, obviously it's really important.
Yeah, it's very important because women will experience a major change in their life, and with a chronic disease, particularly at the time where they may feel fatigue and have to take care of a new baby, then they might have special needs, and that they really need support from their social network, and it's very important, and that can make the difference. And so it's really important to plan the pregnancy and make sure that the postpartum is well planned, to think that, oh, if the baby is born a little bit more before preterm, then we're not caught out guard, and then the rest of the postpartum goes more easily, and have good resource as well with their healthcare professional, but as well as the social network. Yeah.
I work with arthritis consumer experts. We have information about lupus on our website. Are there some other good sources, if some of our viewers want to find more information about lupus, that you can direct them to?
Yes, there's the Lupus Canada. There's probably some information, but Lupus Foundation of America has some information on pregnancy, and also there's the Canadian Arthritis, Canadian Alliance for Patients with Arthritis. They have developed a special tool for patients with arthritis and who are contemplating a pregnancy, and a guide for pregnancy and parenting. So they have also some on the website some information on how some patients have felt in the postpartum. So that might be
excellent.
Yeah.
Well, thank you for sharing that. Thank you for visiting us today, Dr. Vinet. We appreciate it very much.
And we have one question from the audience.
Oh, great.
So they're asking, are there any prenatal classes that's specific for people living with lupus?
No, so there's, to my knowledge, there's no prenatal class, but that would be very interesting and very useful. Okay, and we will be conducting this year at McGill a focus group study with patients with RA and lupus to really try to assess what would be the needs in terms of pregnancy counseling and as well in the postpartum to see what can be done to really improve the information they receive to prepare them the best we can to for pregnancy. But that is it would be very important.
Good question. All right, thanks again, Dr. Vinet.
Thank you very much.